Hello everyone, this is the continuation of interview series questions, and today I'm discussing about how to handle an ethical situation or ethical questions when you're asked in your exams or in the interview questions. My name is Dr. Asma, and I'm working in the NHS for past few years, and the ethical scenarios, they are very important part of any interview questions. And being an international medical graduate, we might have not been experienced all the different facts which come into play when you are dealing in a complex situation. The ethical scenario are mostly very tricky, and they can have multi-pronged answers, but the best way to move forward is that you understand the question and you have clear understanding of the four pillars of medical ethics. Four pillars of medical ethics are autonomy, beneficence, non-maleficence, and justice. Basically, by the examining all these four principles, they are assessing you for your understanding of the NHS system, how strong your communication skills are, and how much can you work on your toes and you can work under pressure, and what are your ethical standards. So now I will be explaining these four principles. Autonomy means that the patient has a right and to decide what treatment option they want to have. So even if they decline a certain treatment option, it's absolutely fine. They have the right to choose their treatment. Second is beneficence. Beneficence means that you are acting in the best interest of the patient and keeping their interest as a priority, without your own personal perceptions or ideas. Third thing is non-maleficence, which means do no harm. So as a medical practitioner, you're oathed that whatever treatment you are giving, you are making sure that the benefits always outweigh the harms, and the harms are kept as minimal. Then is justice. Justice means that all the patients are treated equally. Also, you have to assess the capacity of the patient. For example, if it's a pediatric patient or a patient with terminal illness, or the patient who is not mentally intact to actually make their decisions, so that is called competence. And also advance directive, if there is a certain ready-made plan or already decided plan of action, if for example this situation arises, what would be the outcome. So you should be aware of these things as well. So being a pediatric doctor, I am giving you a very common clinical scenario which comes very frequently in the practices. You encounter in the practice, you encounter in the exams, and also in the NHS interviews. This is about the Gillick competence or Fraser guidelines. So I will put a questions, and then I will give you an ideal answer, and you're more than welcome to take notes and scribble some things, because that you can keep for reference later on. So let's start. So the question is that you are asked to prescribe an oral contraceptive pill for a 15-year-old girl. So the first thing to make you clear is that from 14 to 16 years of age, the pediatric patient actually can accept the treatment, and they can have some bit of autonomy, as of that it's not essential that they have to inform their parents, provided a few certain things are met. But for this specific scenario, any child who is less than 13, you should straight away raise the safeguarding concern, because according to the UK laws, any child who is below the age of 13 should not have a sexual contact. Starting with the ideal answer. Again, the question that I'm asked to prescribe an OCP for a 15-year-old girl. So the first thing is, to answer the question, I will make sure that I maintain the confidentiality and assure that I support them and I develop a rapport with the patient. Also, before prescribing, I would try to establish the nature of sexual relationship if possible, and I would be alert for indication of an abusive relationship. I will explain the physical implications of sexual activity, including pregnancy, sexually transmitted diseases, and I will encourage the patient to tell the parents or trusted adults. So before even prescribing, this is the first part of the questions, that before even going into a scenario, yes or no, I have to assess a few things. I have to take the patient in confidence, I have to maintain the confidentiality, I have to warn them about the physical implication, and I have to encourage them to talk to their adults. Now, before prescribing, also the important thing is that I have to establish Gillick competence. What is Gillick competence? It means that the patient is capable of giving informed consent to the medical treatment without the knowledge of permission of their parents. So they are understanding your advice and engaging with the discussion, and they know what are the implications. So by doing a simple 2-3 question line interview, you can actually make up your mind that this child is understands what he is asking for. Then of course we have to keep the best interest of the patient without parental and advise them the treatment without parental authority. So for instance, if the child is likely to continue sexual relationship with or without contraception, or their mental or physical health or both are likely to suffer if contraception is not given. So in these scenarios, when I have established all this, then I am obliged to prescribe a 15-year-old with the contraception treatment. So this is my model answer, and as I have moved through the segments of the answer, it has clarified that first, without jumping into direct yes or no, there are a few implications that I have to work through. So first is that I have to maintain a rapport, I have to maintain the confidentiality, but at the same time I have to assess risks. And then after that, I have made my mind that I have assessed the Gillick competence. The patient, the child is conversing, he is understanding, he is able to take the information and reproduce and know the implications of what the actions are resulting in. And then I'm obliged, when I have gone through all these screening questions in my mind, and now I'm obliged to prescribe, because if I think that it is in the best interest and the child would continue to have this risky behavior, that will actually be detrimental to their physical and mental health. So also take this as an opportunity to explore and provide them with further help and further guidelines for sexual clinics or STI clinics, and further education and links. So this is my model answer, and I hope this helps, and thank you very much for watching.